Hello, my name is Anna Decker, and I'm joined with the rest of the group, Ruth, Bella, Erica, and Tara. And today we are going to be talking about CAUTI's, CAUTI incidents and quality improvement. So, just for a little bit of background, we chose CAUTI's specifically with the geriatric population because the geriatric population is most likely in the United States to have long-term indwelling catheters. Um, CAUTIs are an important area to address because they make up 9% of all hospital-associated infections. In the United States, there are 13,000 deaths per year due to the infections caused by CAUTIs. So in 1 month, so if you have your indwelling for 1 month, your chance of acquiring a CAUTI increases by 100%. So our group felt that focusing on quality improvement controls for managing long-term indwelling catheters was a good thing to focus on.
So for our change theory, we chose Havelock's theory, which provides 6 steps that lay out innovative change that is both attainable and sustainable for change in the future. So the first step is building a relationship. And with our population, the conversation would be started in the healthcare team within the long-term care facility. And in that time, they would identify the risk of CAUTIs for the residents within that facility with long-term catheter usage. Then that moves into the second step, which is diagnosing the problem, which further along addresses the risk, but then also looks at the incidence of CAUTIs determined in that setting and the need and implementation of the CAUTI protocol further in that setting, and also identifying that the protocol would be beneficial for the population. The third step is then acquiring the resources for this change. So some of the things that we identified, such as CHG wipes, frequent peri-care, iodine swabs, sterile kits, those are all really important as part of the bundle. So those resources would need to be acquired, as well as actually finding the resources of how the bundle is going to actually be placed somewhere, such as like a physical copy of the paper or laminated thing for that. So that needs to be addressed before moving on to the fourth step, which is then selecting a pathway. So there's different options that we could pursue in this, but we specifically are going to be taking a holistic approach in the bundle that we're creating, but some specific focuses we could choose in the pathway could be such as documentation of regular peri-care or another aspect. After selecting the pathway, we then move on to the step of establishing and accepting the change, which would be to assess the staff members and their willingness to the change, as well as just communicating the importance of the change, such as the patient's safety. So also providing an encouraging discussion for the staff members involved. Lastly, maintenance and separation is where we then would look at, are the staff members actually adhering to this bundle and making sure that they have the needed supplies to further carry out this care. And also this would include the documentation and care actually provided.
Okay, so just a summary of our quality improvement. The goal of our project is to reduce the incidence of CAUTIs in long-term care facilities, and we said that success can be measured through monthly evaluations of units and seeing if there was a decrease in CAUTI cases after the implementation of the bundle. And then some stakeholders that would be involved include RNs, since they are the individuals that are directly implementing changes and providing direct care to patients. They are also the ones that are like inserting the Foleys and keeping up with the maintenance of them. And then next, providers, they are the individuals that are responsible for implementing and changing orders to prevent CAUTI prevention in patients with Foleys. So they ultimately make the decision to remove or insert a Foley. And then there's the organization and the hospital, since they are the ones that need to ensure supplies are provided for the units, and they budget the costs and finances in order to accommodate for changes. implemented by the bundle. And then there's the suppliers that are the companies that sell products related to Foley's. We want to make sure that those products are being tested and we know for sure that they're functional and safe to use. And then there's nursing informatics specialists who are in charge of analyzing EHRs and charts to track trends in patient data to create results to inform decisions on protocols. We said our underserved population is the individuals in long-term care facilities, the geriatric individuals, and then some data that show that this quality improvement study should be done is that catheter prevalence in nursing home residents ranges from 5 to 22% of all residents, which is a pretty big chunk of that population. 13% of admissions into nursing homes are patients who already have a Foley, so need to make sure that indication is up to date and to make sure maintenance is being done. And then the most common infection in older adults is UTIs, and it's been seen that catheterized residents have 6.2 clinically defined UTIs per 1,000 follow-up days, requiring at least 5 days of antibiotics compared to 2.8 UTIs per 100 days in non-catheterized residents. And we also know that UTIs can lead to complications like prostatitis, penile ulcerations, obstruction, and trauma. So just want to avoid all of that. And then a few barriers to implementing this change is one, staffing challenges, the nurse to patient ratios. Managers need to make sure that the patient load isn't too high for individual nurses so that they're able to do their cares fully and not skip anything. Lack of time could be a thing since training staff and implementing changes does take time. Additional expenses, and then educating other staff like CNAs to make sure that everybody in the unit is aware of the bundle changes.
Okay, and then I will be talking a little bit about our project plan. So that's going to include the goals of our project and then the action steps that we will take to follow through with the implementation of the CAUTI bundle. So the first goal that we talk about is the unit will demonstrate a 60% decrease in CAUTI incidence by 6 months after the implementation of the bundle. So some steps that we can take to try to reach that goal are ensuring that staff has been trained on the CAUTI prevention bundle, that performing and documenting catheter care at the start of each shift is getting done, and then pushing for a 75% charting completion on pericare or catheter care across the unit as a whole after the first month of the bundle implementation. And these things are just going to help to make sure that the bundle is being adhered to and that understanding is happening. And then hopefully we can see that decrease in CAUTI. And then our second goal is that the unit develops a CAUTI prevention protocol prior to the implementation of the bundle. So making sure that they have the protocol and they're familiar with it before implementing it. So some steps that could be taken to do that are that the charge nurse would identify some leading risk factors for CAUTI to know what we're targeting. The charge nurse can develop a standard for catheter placement and care and making sure that's across the unit as a whole. And then the unit will obtain necessary supplies such as CHG wipes, iodine swabs, and sterile kits, because the thought is if this unit isn't stocked and ready to adhere to the bundle, then implementation is not going to go as well. And then our third goal is that the nurse will identify the need for catheter usage daily and remove catheters as necessary during each shift. This goal is more related to that underserved population, which we identified as geriatric population within like nursing homes, long-term care centers. And we identified this because sometimes catheters can be placed or left in place out of convenience. And that's also why catheter cares can be missed, is because it's something that's easy to skip in your day. So this goal is to try to address those concerns within a long-term care facility. Our steps to make sure we reach that goal are to analyze the patient chart for related medical conditions or risk factors that make a client a candidate for continued catheterization. So to make sure they only have a catheter if they need one. Nurses will contact providers to determine medical necessity for catheterization. So again, making sure they need that catheter in the first place. To consider intermittent catheterization or another non-invasive step. And then to educate the patient on indications for catheterization so that they understand why they're getting a catheter, and then also signs and symptoms of infection. The fourth goal that we have is that the bedside nurse will demonstrate an understanding of the new CAUTI protocol by teachback prior to the implementation of the bundle. So the nurses should know what they're going to be doing with the bundle before they implement it. So the nurse manager, the action will be to touch base with the nurse prior to catheterization. The nurse manager will ask the nurse to explain the bundle, like teach it back and ensure that they are understanding it. And then the nurse will have the patient teach back signs and symptoms of infection, just so we can make sure everyone involved has a clear understanding of what we're trying to achieve. And then after we take these steps, we're going to move a little bit more towards evaluation, which is going to be our next section.
So here are some of the ways we're going to evaluate our plan just to ensure that it's effective. So first, we are going to go through with quizzing monthly for the nurses to ensure that they have adequate knowledge on the CAUTI bundle itself. Furthermore, there will be different audits that are going to be taking place, such as the documentation of the catheter cares themselves, also patient outcomes that will be documented in the charts, as well as the resources and how they might be stocked on the unit. Also, there is going to be a document in the Planet Care to determine whether the patient actually meets the criteria or not, and that's going to be assessed in the evaluation. Some other outcomes might include a checklist for the indications of the catheter the patient teach back regarding the adequate care that they received and equally are implementing themselves. Also, dual sign-off and insertions for catheters are a few ways we're going to evaluate, and other further detailed audits on documentation.
Okay, and then as we know, the Agency for Healthcare Research and Quality embodies the mission to produce evidence to make healthcare safer, higher quality, equitable, affordable, and effective. They work with the U.S. Department of Health and Human Services and also with other organizations that make sure that the evidence they are finding is understood and put into practice. Their goals include keeping patients safe, helping doctors and nurses improve quality, and develop data to track changes in the system. And our project relates to this through the professional development of the catheter utilization, catheter care, and antimicrobial stewardship. And then through these changes that we've talked about, this will promote patient safety by decreasing the CAUTIs, and then team building with the collaboration with the nurses, CNAs, and other providers to assess the need for it, and then leadership engagement to assess the need for the catheter and other options as well instead of one. And our goal of this change is to reduce CAUTI, and in this, we are also saving lives. And that is it.